If you've been around Western Sydney in the last couple of days, you'll see that there are hundreds of people desperately lining up to get a COVID vaccine. One at a mosque in Sydney's southwest, and the area has been deemed the epicentre of the pandemic. All of the people queued up at the Lakemba pop-up vaccination hub are offered a vaccine, but the majority of them want the Pfizer jab, which is still low on supply. Joining me live now is the Mayor of Canterbury-Bankstown, Khal Asfour. Mayor, thanks so much for your time. First of all, how are you and how's your community doing?
Look, it's a tough time. It's getting harder by the day. The community's really, struggling with a never-ending lockdown. So, but we're resilient and we'll get through it.
Yeah, look, we hear day in, day out that the reason that these restrictions aren't working is because some people aren't complying. Is that true?
Look, I don't think that's totally true. Of course, there are some people not complying. That's happening across New South Wales, and we've seen that with the virus spreading into the regions because people are doing the wrong thing. But the majority of people in Canterbury-Bankstown are doing the right thing. And I really think it's an insult that we continue to get blamed by the government at the presser every morning that we're the reason that the numbers are so high.
Yeah, we heard Brad Hazzard say yesterday that some people with a quote-unquote certain background are not following the rules. What did you take that to mean?
Look, I think that's just having a racist dig at our community. I think that's not the case at all. If you speak to our police, if you look at the mobility rates, they're down to 40%. We've got a lot of authorised workers here in Canterbury-Bankstown. People, and maybe the authorised list is too long, but we've got a lot of authorised workers here that are feeding the rest of Sydney. We contribute $16 billion to the New South Wales economy every year pre-COVID. So, if the minister wants to start attacking our community, he needs to realise that it's our community that's probably putting food on his dinner plate every night because we're servicing and feeding the rest of Sydney. And, if people are getting COVID because they're doing their jobs, if people are getting COVID because they're doing things that are legal, that's, that just tells you that the government doesn't, have control of the virus and doesn't know how to reduce the numbers.
Well, the numbers aren't reducing, and it doesn't even seem like a suppression or elimination is the goal anymore. It's getting vaccines in arms. How has your community responded to that request?
Look, I think we're doing really well. We've got lines at our vaccination centres. I visited the Lakemba Mosque yesterday to see the line, and there were people that was camping out overnight to be first in to get the vaccine. There were thousands of people there by 9 a.m. and it didn't open till 10. The problem is, though, they've got a hesitancy to AstraZeneca. No matter how hard we push as community leaders, no matter how hard New South Wales Health pushes, there's still that hesitancy. So we've got construction workers now that are being mandated to get the vaccine if they want to go to work, and they're all lining up to get the AstraZeneca jab. Unfortunately, they're doing it, not wanting to do it, but sort of being forced to do it. And they understand that. But the reality is there's such a hesitancy towards AstraZeneca and there's not enough Pfizer supply. I'm only hoping that when Moderna comes in next month that they don't botch the marketing and that people are more than prepared to get it.
Well, tell us about the construction workers in particular, because as you say, a lot of your community is keeping what is left of this economy going. It is putting food on our tables. These are critical workers, particularly in the construction sector. These are young, mostly men who need to go to work sites and they're being asked to get vaccinated in order to do that. What's the anecdotal feedback you're getting, Mayor, about how easy it is for these young people?
Look, it's been tough, obviously, with construction being closed, and we're really happy that it's back open now. What they're really sort of worried about is they want to get the Pfizer jab, is what I'm hearing anecdotally, but they're going to have to wait 2 or 3 months to get it. And that's really causing them some problems where some of them feel that they're being forced to go and get the AstraZeneca jab. But the reality is that most of them are also really, really angry at the government, that they feel they're being treated as second-class citizens when there are construction workers in Greater Sydney that can come into Canterbury-Bankstown from today without having to get the jab, without having to get tested, and potentially bring the virus with them. I think that's just not fair. And we should be, all in, one in, all in, and not have this separation within industry. If there's an issue in an industry where the government wants to make sure that everyone gets the vaccine, then they should do that for the entire sector, not just, according to the postcode of where these people are living. And it just makes me wonder, what's next?
But isn't it fair to say that, we see the case numbers, we see that the numbers are highest where you are. So the risk of someone actually bringing it into your area is much lower than it being exported from Canterbury-Bankstown. Wouldn't you accept?
I wouldn't accept that, because yesterday's figures, there was about 70 or 60 to 70 cases in Canterbury-Bankstown out of the 300. So there's 300 cases across New South Wales. 300 cases is a lot of cases, and any one of them could be a construction worker that could be bringing the virus back into our community. I think it's a dangerous thing. I think if you're going to make sure that people get the jab to go to work, make it for everybody. That's fair. I think the policy right now for our construction workers is unfair. And the point I was going to make is, if we've got police that are here, we've got, an extra amount of police that are here, they're not necessarily having to be vaccinated or tested either. We've got healthcare workers, we've got people in all types of industries that are leaving Canterbury-Bankstown and coming back in and potentially bringing the virus with them and infecting their families. So I just think the rules should be the same for everyone. We should be treated the same as everyone.
You're right in the centre of it there. You speak to people day in, day out. What do you think needs to be done to make sure people are complying, to get the numbers down?
I think mobility is down. I think the majority of people are complying. I think the government's lost control. We need to do now is get jabs in arms, and I plead on everyone to go and get the vaccination. And for those that are hesitant, understand that AstraZeneca is there for you to take, and I really want them to do that. I don't think we can start, trying to play catch up and getting down to zero. Everyone wants to get back to work. Everyone wants to get out of lockdown, and I plead with everyone to do the right thing. And I want to, congratulate the majority of my community, because, a lot of them are doing the right thing, and the data proves that.
What more do you need at this point, do you think, whether it's help?
Look, we need government
financial support.
We need the government support to flow through. At the moment, the government's talked a big game about making sure that small businesses are going to be sent government money to survive so they don't crumble. At the moment, a lot of those businesses haven't had a dollar flow through to their bank accounts. So you can only understand the anxiety, the pressure that's on the members of the community that are, at home, not sure how they're going to be paying their bills, not sure if they're going to be going back to work, not sure if their business can survive. So we really need that money to flow through to the bank accounts of the people that need it. We've also got a high demand for our not-for-profit sector on food vouchers and the like. People are really struggling out here, so we really need support in that as well.
Okay, well, that's good to know. And look, on that business support, we are going to be speaking to Damien Tudor-Hope, the Small Business Minister, on this program in half an hour. He spoke to us last week, Mayor, and he said that these problems were being ironed out. So stay tuned. We should have some answers for you in about 20 minutes. Thanks so much for your time, as always.
Fingers crossed. Thank you.